Which of the following is not a normal part of taking a patient's vitals? A. Overall visual appearance. B. Pulse. C. Temperature. D. All of these are part of taking a patient's vitals. The answer is D. All of these are part of taking a patient's vitals. While most examiners remember to take the pulse, temperature, and blood pressure while assessing their patient's vitals, overall visual appearance is also an important part of an individual's vitals. Does the patient appear ill? Anxious? Are there any noticeable issues with hygiene or bizarre dress or movements? Are there any signs of pallor, jaundice, or cyanosis? All of these observations can be quickly noted in a patient's chart when taking vitals. The pulse of your patient is 120 beats per minute. What is the appropriate term for this finding? A. Normal heart rate. B. Tachycardia. C. Bradycardia. D. Aortic stenosis. E. Asystole. The answer is B. Tachycardia. Tachycardia is the term used to describe a faster than normal heart rate. A heart rate of more than 100 beats per minute is considered tachycardic. Bradycardia is used to describe a slower than normal heart rate. Less than 60 beats per minute is considered bradycardia. The physician on call pages you to ask if the patient you are taking care of is febrile. Which of the following vital signs would you find in an febrile patient? A. Blood pressure of 105/89 millimeters of mercury. B. Temperature of 97.9 degrees Fahrenheit. C. Respiratory rate greater than 25 breaths per minute. D. Heart rate of 105 beats per minute. E. Temperature of 103.2 degrees Fahrenheit. The answer is B. Temperature of 97.9 degrees Fahrenheit. Febrile is a term used to describe a patient who does not have a fever. Clinically, a fever is defined as a temperature greater than 100.4 degrees Fahrenheit. Blood pressure, heart rate, and respiratory rate do not tell you if the patient has a fever. A 39-year-old man presents to the ER with weakness, confusion, and vertigo. His heart rate is 91 and bounding, blood pressure is 132/85 millimeters of mercury, temperature is 99.0 F, and blood glucose is 49 milligrams per deciliter. He is non-diabetic, he is not on any medication, and he denies recreational drug use. Which of the following is the most likely cause of his symptoms? A. Hypertension. B. Hypoglycemia. C. Panic attack. D. Infection. The answer is B. Hypoglycemia. The most likely cause of his symptoms is hypoglycemia, which is defined as a blood glucose below 50 milligrams per deciliter in a non-diabetic patient. The symptoms of hypoglycemia include altered consciousness, tremors, weakness, vertigo, headaches, heart palpitations, and a bounding pulse. A temperature of 99.0 degrees Fahrenheit is not considered abnormal as it may reflect a normal variation in body temperature. His blood pressure is slightly elevated, but it is unclear whether this is typical for him or whether this represents a significant change from his normal blood pressure. Regardless, it would not likely be sufficiently elevated to cause his symptoms. It is also possible he may be experiencing a panic attack, but in the presence of his depressed blood sugar, and absence of signs of anxiety, hypoglycemia is the most likely cause of his symptoms. Abdominal rigidity and decreased bowel sounds would raise your suspicions of what condition? A. Cystitis. B. Cholecystitis. C. Peritonitis. D. Ulcerative colitis. The answer is C. Peritonitis. Abdominal rigidity and decreased bowel sounds are classic signs of peritonitis. In addition, the patient will often want to lie very still, as any motion often increases pain. Cystitis, ulcerative colitis, and cholecystitis all may cause significant abdominal tenderness but would not generally result in rigidity or decreased bowel sounds.